Hello everyone, today we will cover main points of blood draw techniques. First we will cover the supplies. You need a tourniquet to apply pressure above the diastolic and below the systolic pressure. You will need your blood collection tubes or vacutainers. These are vacuum tubes. You need your cotton ball, specimen labels with the patient's name, date of birth, and collection date. You need medical tape. Keep a piece of medical tape off to the side for immediate use. You need 3 alcohol swabs, a tray for the blood collection tubes, and hand sanitizer to sanitize your hands. You will also need a sharps disposal container nearby. Lastly, you will need a needle. This needle is assembled with its adapter on. This is a double-sided needle. One side will go into the patient's vein, the other side will go into the vacutainer. The purple part is a shield that covers the needle after being removed from the patient for your safety. Under the white cover, there is a needle covered by a plastic sleeve. This plastic sleeve gets pushed back by the stopper of the vacutainer, exposing the needle and allowing the blood to flow inside the tube. Here we will reassemble the adapter. It has 2 tabs, one for locking the needle and one for discarding the needle. Under the black cover is a needle that goes into the patient's vein. Remove the cover with one hand to inspect your needle for any defects. Gently put it back without contaminating the needle. Now for the demonstration. Put the tourniquet under the patient's arm 3 inches or more above the intended puncture site. Lay each side over the patient's arm like so. With your left index finger and thumb, grab the right end of the tourniquet, and with your right index finger and thumb, grab the left side of the tourniquet. Pulling the ends tight, cross them over each other. Tuck the left end under the left index finger. The tourniquet should be laying flat and the ends should be laying upward to avoid contamination of the area. Make sure the patient's arm is fully extended, including the elbow. Palpate the patient's arm for the most prominent and anchored vein. The main choice is the antecubital vein. However, you can use the basilic or cephalic vein. Release the tourniquet and use an alcohol swab to clean the intended puncture site 3 times or more until the last swab is clean. For the purposes of this demonstration, we will only use it once. While the alcohol is drying, thread your needle into the adapter. Pull back the shield and with one hand remove the black cover. Inspect your needle for defects. Safely put the needle back into the cover without contaminating the needle. In the case of contamination, discard it right away. Tie the tourniquet again. Apply gentle traction underneath the intended puncture site. Insert the needle into the vein's lumen at a low angle. Apply a firm downward pressure to stabilize your hand. Make sure your grip on the adapter is also firm. Insert the vacutainer by pushing the base with your thumb and holding the adapter wings with your index and middle finger. The blood will flow into the vacutainer. After the tube is filled, keep a firm grip on the adapter and pull the tube out with your middle finger and thumb, while counteracting by your index finger. That will stabilize the adapter. Mix gently. By inversion, do not shake. Put the tube in the tray. Grab the second tube and repeat the process. When the tube is filled 2/3 of the way, release the tourniquet. Remove the tube when it's full. Mix gently and put in the tray. Remove the needle gently by applying downward pressure while removing the needle. Shield the needle as it comes out. Discard the needle in Sharp's disposal container by pushing the colored tab on the adapter. Apply cotton to the puncture site and secure with tape. Invert your tubes once again and label them neatly with the specimen label. Remember to give your patient after procedure instructions.